Hello. Freedom for all for freedom. So the issue is about our leader, Colonel Dr. Kizza Besigye. You are well aware that he was in Mulago. We moved to Mulago to check on him. We were denied access. And we think we have the right of seeing him and knowing how he is. A few days after we were denied access, some government official went there and he was allowed access. But immediately when he left Mulago, Dr. Besigye was evacuated from Mulago. The last press conference we held here, our demand was one, because Dr. Besigye's health was still bad, in a bad condition, and we were demanding for him to be taken for further specialized treatment outside the country, which the family can afford. And if this country or this government decides to take him as a prison, still the country can afford. They have been taking themselves for specialized treatment on our taxes as Ugandans. Dr. Besigye also deserves that. That was our message to the country. So we heard he was evacuated, and we thought he was taken outside the country for further treatment, because by the time he left Mulago, he was still in ICU. He was still in HDU. That is the second stage of ICU. From ICU, they took him to HDU. And that's where the minister, Chris Baryomusi, found him, before he made orders for him to be removed from Mulago. Mulago cannot refer a sick patient who has not healed to a health center, to a sub-county, or to a clinic, or even to a district hospital. Mulago, Dr. Besigye should have left Mulago when he is healed, but he left when he has not healed. Up to now, Dr. Besigye doesn't talk. He doesn't walk, he doesn't speak, but he's not in Mulago and he's not outside the country. Yesterday was a VD in Ruzira Upper, and Friday was a VD in Machon prison. We tried to go there to check on his condition. Dr. Besigye is not in upper prison in a sick bay. Dr. Besigye is not at Machon Bay, Ruzira, where there is a referral for all other prisoners. So we come here to ask, where is he being treated from? And who referred him? And what condition is he in? Is he back to the military hospital in Buya? Because we came here and we told you, from court, he was not taken to Mulago, he was not taken to any clinic around, but our antennas informed us that he was taken to Buya Military Hospital. Whatever is happening to him, it's not because of his health failure. It is intended, and he was worked on to be in that situation. We want to reiterate our demand. Dr. Besigye should be in a facility that is known to Ugandans. By law, all prisons refer their patients to Machon Bay. Dr. Besigye is not there. He didn't leave Mulago that he was okay to go back to prison. Ugandans must understand this. At first we were worried. We thought that they were taking him back to the cells. We checked with his colleague, Hajo Bedi Rutale. Dr. Besigye is not in the cells at upper prison. And he's not in the sick bay. Where is he? Whatever they are doing, we think they are trying to cook a medical report of trial. They want to make a report that he's fit for trial. We are waiting to see how a person who doesn't talk, who doesn't stand, how he will be taken to court on 18th and how he will be tried. But we told you before, our main focus now and our main interest now is the health of Dr. Kizza Besigye. Even if they want to convict him, they should convict a man who is alive. Even if they want to shoot him dead like what they already told us, they should shoot a man who is alive. We are demanding to know where he's being treated. And we are demanding the prisons officers and the Minister of Health to tell us whether Mulago can refer a sick person to a health center or to a district hospital or to a military hospital or to a clinic where he is now. We can be here when he's in a basement. When he's being treated in a basement, you can't even know which kind of medicines and which kind of doctors are handling him. Mulago has specialists, Mulago has consultants. His situation should be in Mulago. And if he's not in Mulago, he should be taken for specialized attention abroad in the country. His family can afford, and this country can afford. Hello? That's our demand. And we want to repeat it and repeat it again. Those people who are not liked by Ugandans are evacuated and taken for treatment outside on our taxes. But Dr. Besigye is a loved person. He's a darling to Ugandans who pay taxes. Why can't he also have that specialized treatment so that they bring him back when he's healthy and when he can stand trial? At the moment, he cannot stand trial. Remember, up to now, the intimidation to his lawyers is being intensified. Several lawyers are getting out of the case because of intimidation. They are running for their lives. Others have run outside the country. They have run away. Dear prisons officers, Dr. Besigye is not in Machison Health Facility. Dr. Besigye is not at Ruzira Upper Prison, and you took him from Mulago Hospital. Where is he? That is our question. Lukwago is at Machison. We can confirm that. His situation is bad, as you well know. There was a report for him to be taken to India. But as of now, we learn that that report that was signed by 5 doctors has since been distorted. It's no longer the report they gave. Nobody should take our silence as a sign of surrender. Tujja.